So we've looked at the home care aide profession in 3 previous audits beginning in 2013. We did one in 2014 as well as earlier this year. And throughout those audits, we've heard from stakeholders that there may be some barriers for applicants in their attempt to obtain a certification for becoming a home care aide.
So for our objective, we wanted to know what barriers applicants face when trying to gain a home care aide certification, and we wanted to know what improvements agencies made to help them get that certification. In order to answer our objectives, we conducted phone interviews with 126 applicants who didn't obtain certification to assess whether and where they faced barriers.
We found that about a quarter of the applicants we spoke with dropped out for personal reasons, so they perhaps found a better job or realized that this line of work wasn't for them, or they moved out of the area.
However, 2/3 dropped out due to a barrier. We found that almost 70% of the people who dropped out had an issue with training. Many of them couldn't find training courses that were convenient to their schedules. Others couldn't find locations close to where they lived, and some thought training didn't prepare them for the exam.
Now, DSHS is working with the training partnership as well as community instructors in order to increase the number of trainings that they offer, and they're also looking at offering alternative schedules, such as 3 days a week for 4 weeks, or even evening classes. And they're also assessing the success of a pilot program that they implemented last year that offered part of the training via online.
More than half the applicants had trouble signing up for the exam. Some experienced difficulties finding convenient locations for testing. Others thought the testing environment was poor, so they had a hard time concentrating during the test. And some thought there was too much time between completing training and the scheduled testing date.
DOH is continuously trying to increase the number of exam locations across the state. They have recently added Federal Way as an exam location, and they're working on adding Yakima. This will help limit the amount of travel that applicants have to endure in order to travel to an exam location. They have also combined the initial home care aide application with the testing application. This helps schedule the exam a lot quicker, so applicants don't have to wait in order to receive an exam date.
60% of limited English proficiency applicants, or LEP, dropped out of the program. Many had trouble finding testing and training in their language. Others thought their translation for the training and testing were poor, especially on medical terms. They didn't think they were translated correctly and had more trouble actually reading the test and trying to read the training.
The exam is already offered in 12 different languages, and they offer interpretive services for those other than the 12 languages that are already offered. They have also recreated the exam to better reflect the applicant's comprehension of the materials as opposed to their ability to take tests. So they're hoping to see an improvement in the passing rate for those applicants to take the exam.
We recommended that the Department of Social and Health Services and the Department of Health continue to identify and address barriers to certification. Specifically, we recommended they increase the number of testing and training locations and also adopt flexible schedules.
We also recommend that the agencies consider expanding the number of languages currently available for training and the exam, as well as emphasizing to the applicants the importance of taking the exam as close as possible to completing their training.